Any amount of bleeding at all is considered a threatened miscarriage. So many women actually experience bleeding when they are pregnant, really in the early times. There could be so many reasons for this happening. My name is Dr Ajayi, and I am an obstetrician and gynecologist. I'm the medical director of Clearview Hospital in Lekki, Lagos. This is Ask Baby Migo. At 9 weeks of pregnancy, if you start spotting or any amount of bleeding at all, is considered a threatened miscarriage. So many women actually experience bleeding when they are pregnant, really in the early times. There could be threatened miscarriage most times will resolve on its own. But it's always advisable to go and see your doctor from the very first time you notice that kind of thing, so that they can examine you, run tests, perform ultrasound scans and things like that to determine how viable that pregnancy is. Viable means that the pregnancy is there and there's a heartbeat, and that the size of the baby is actually appropriate for the age. It also helps us to find out whether the placenta is where it's supposed to be, whether there's any bleeding behind the placenta, whether the cervix is opening, things like that can be found out right there in clinic. If the scan is performed and there is nothing untoward, most times we just say, go home and rest. And believe me, bed rest solves a lot of problems. By the time you go home and rest, most bleedings tend to resolve without any major treatments. What some of us will do when people come like that is that we also try to rule out things that could mitigate against pregnancy. So we look for things like malaria. We want to be sure that you're not anemic. We want to check that you don't have a urinary tract infection. By the time we've ruled out all those things and we don't need to treat any of them, then the most important thing is just to rest. Let nature do its thing. Most of the time, by the time you rest, the bleeding resolves. And by the time you're getting to the second trimester, you're okay. So there's no need to panic. If there's associated pain with that bleeding, run straight to the hospital.